So first trimester is for first 12 weeks. That is in the book nicely written. Next I will point out the some information, that is amenorrhea. Number one is amenorrhea. Why amenorrhea? You know, we discussed it before. So changes in the breast, changes in the cervix, vagina, like this. Amenorrhea, changes in the breast. There is first symptom, sometimes the tingling of the breast. Breast tenderness, like this. Increased frequency of micturition. Why it is increased frequency of micturition? As the growing uterus is more anteplast and push on the place on the bladder, so there is increased frequency of micturition. And other findings are paravaginal examination. The changes in the color of the vagina, vulva, and cervix. Sometimes they accumulate signs and differences. The cervix becomes softer, bluish color, vaginal wall become soft, and the changes in the color due to increased vascularity. There is demand for increased vascularity. This is, and then other findings, what you know, that is you can do the paravaginal examination. Sometimes we do paravaginal examination. There is changes in the size of the uterus. Sometimes you know the pear-shaped, pear-shaped, small pear-shaped, then it becomes orange shape, then it becomes somewhat larger, like a small ball or like this, 8 week size. So the size of the uterus like this, pear-shaped, then orange shape, then small ball like, but it is within the pelvic cavity. It is not above the region of the pubic symphysis. At the level of the pubic symphysis, it is 12 weeks. And when it is palpable above the pubic symphysis, you know the pubis. Above the pubic symphysis, that means more than 12 weeks. But sometimes it is different due to obesity and lean and thin body. Sometimes it is some change in the size and shape due to the configuration of the pelvis. If small pelvis, then maybe some palpable more earlier, paravaginally, parabdominally. Okay. Then now investigation. How you confirm the pregnancy? Laboratory investigation. Hormone is egg donation inhibition test. There is HCG hormone. There is antibody form. There is what is HCG antigen, where it is available in the blood and also in the urine. And HCG hormone present in the blood and urine. So blood we do the what we do mostly HCG, beta HCG. Beta HCG unique for pregnancy. As it is glycoprotein, the thyroid stimulating hormone and other glycoprotein both have alpha and beta unit. But for like this HCG, beta unit is different for different hormone. But alpha unit is all are same. Beta unit is different glycoprotein. So beta HCG, it is unique for the HCG. So we do the beta HCG. How can we diagnose? Radioimmunoassay, enzyme-linked immunoassay, different immunoassay test is available. So we do the radio like this, ELISA method like this mostly, and other method also. And in the urine, what we do? Agglutination inhibition test, that is antigen antibody reaction. So if there is antigen, that is HCG present in the urine, we diagnose the pregnancy. Okay. And any other test that is now easily available. What are easily? Ultrasonography, right? Ultrasonography of the pelvis, lower abdomen. What we do? Transvaginal ultrasonogram we can do. Why we do the ultrasonogram? Ultrasonogram, what we show? The pregnancy size, age of the pregnancy, location of the pregnancy, and duration of the pregnancy. That means how can we do the crown ram length? You know the crown ram length? Crown ram, but the fetal pole, upper and lower pole measurement. Okay. Crown rump. You know the name crown rump, RUMP, rump length, and then yolk sac like this, and liquor also. Fluid we can diagnose, and the position. Sometimes you know the ectopic pregnancy. You can diagnose easily by the ultrasonogram. That is location of the pregnancy. So aging of the pregnancy, location of the pregnancy, and most important is viability. Either the fetus is alive or death or growth, like this. So ultrasonography is important for 3 or 4 more different regions. We can diagnose the pregnancy by ultrasonogram. So location, aging, viability are the most important. Okay. Then so diagnosis. Now management in the first trimester. What are the management? Last class I discussed with the minor ailments during pregnancy. What I discussed? Like constipation, inflammation, backache, like this. So if these problems, patient problems, we should manage them that way. Otherwise, patient will give some advice on the diagnosis. We should during first checkup we should discuss about this. That is my advice about nutrition, or what are the advices, how she should take the rest, what are the food she should take, what are the food are contraindicated, like this. Would you know any food is contraindicated during pregnancy? Pineapple, you know the pineapple? Those causes some purgative life action or contract the organ. It should be avoided, like this. More junk food, that is. So some food should be avoided during pregnancy. Papaya is also problem. Pepe, that is. Anyway, so you should go through the books. Also in these books all are written. Okay, advice, you should know the proper advice, how you guide the patient, how she should come to us, like this. Okay, now next checkup regarding the next follow-up, you should follow the protocol of management, and that is WHO guidelines you should follow. Now to come to the second trimester. You find out the guideline of your syllabus, or that is when you class is ended, 9th September. You should finish the class and then block placement. Would you find the guideline? No. Okay, I will send the WhatsApp group. There is a guideline arranged. All the year. All the class should be in the 9th September. So by this time we should finish the lecture class. So I calculate about 30 class possibly we find out from today, and 15 for gynae class, 15 for ops class. So we should finish important topics. So mostly we can highlight all the classes. Okay? And actually the lecture class, I feel nobody from the lecture class. Just you should vision about and some information of the topics. But you should individually read all the subjects. Okay? Now second trimester like this, amenorrhea always should be present, and in the second trimester what is important, that is quickening. You know heard the term the quickening? Quickening is the active feeling of the active movement of the fetus by the mother, quickening. So that is important. Usually it starts 20 weeks mother can feel, and in the primary she can feel on 24 weeks. Why there is movement, active movement of the fetus, mother can feel. So this is the quickening. So the quickening in the second trimester. Okay? And some breast changes is more enlarged, more pigmentation, abdominal wall also there is changes in the abdominal wall, cutaneous change, and like this. And other, how can we confirm the pregnancy? Like as usual. Here mostly we do the ultrasonogram, as it is available, so we do the ultrasonogram. By ultrasonogram, how can they measure the aging, the biometry of the fetus? You heard the name, the biometry? Biometry means measurement of the biparatal diameter, abdominal circumference, femoral length. These are the biometry. and they locate the placenta. So placenta, that is maturity, they can find the placental maturity and the fetal heart sound, and the Doppler, you know, the Doppler study of the vessel, different vessels, umbilical vessels, and placentation, placentography. You heard the name placentography? There is a term placentography, that is placental anatomy, either normal or abnormal. You know the some abnormal shape of the placenta, like the bipartite, tripartite, or placenta, what is succinatory lobe, accessory lobe, like this. So that is placentography. Okay.